We're going on an adventure, Team HealthTech. So if there's one thing that we're not short of in this industry of healthcare is expos and events and meetups, because they're a great way to bring the ecosystem together, which is what this podcast is all about, right? Breaking down the silos, improving patient outcomes, reducing the inefficiencies, all of that. And these events do a lot of that too, right? Bring everyone together to learn and connect. It's all really important. And Australian Healthcare Week does a really good job of that, and that's where we're going today. So at Australian Healthcare Week, there'll be 1,500 attendees, 150 different speakers, lots of exhibitors, 7 different stages, including the digital health stage, as well as patient experience, aged care, startups, and a lot more. It's definitely the place to be this week if you're in Sydney and have anything to do with healthcare. Talking HealthTech's not just attending Australian Healthcare Week, but we'll be exhibiting right here next to the digital health stage. We'll be recording interviews with speakers, catching up with other attendees, THT Plus members, and just anyone else that's attending the event. Now, I know what you might be thinking, which is, that's all well and good, Pete, but what's the go with the van? Because most people, when they do an exhibition, they get their stuff couriered in, they just rock up to their booth and it's all ready to go. But here I am, lugging everything in and setting it up myself. I don't know, it's like a sense of adventure or creativity, doing it yourself, getting your hands dirty. That's just always been my way. Hey, look, the quality of the sessions that are going to happen here at Australian Healthcare Week are really good. I had a sneak peek at the agenda, and there's going to be sessions on the digital health stage just there about how consumer expectations have shifted about healthcare innovation and technology, and with that shift to more patient-centric health, the role that interoperability plays with all of that. There's going to be that discussion about activity-based funding and value-based care, digital health record rollouts, lessons learnt from different healthcare systems, how we keep the momentum going post-COVID with innovation, how to demonstrate return on investment on innovative technologies like virtual reality in a public health setting, how technology can help with that burden on the frontline workforce in rural and remote areas across Australia. And that's just all happening on the digital health stage, and there's a bunch of other stages with some great content on them today as well. So in this episode today, we're bringing you conversations we had with speakers, attendees, and anyone else at Australian Healthcare Week 2023. Collaboration starts with a conversation, Team HealthTech. Let's make it happen.
This is Talking HealthTech with me, Peter Birch, featuring content and community about technology in healthcare.
My name's Harry Iles-Mann, joining you from Gadigal Land here in Sydney, resident of Sydney as well. I'm a health consumer leader and I run a co-design and lived experience engagement consultancy as well. So I did a lot of work with the health sector around how best to engage meaningfully and valuably with health consumers, patients and the community.
Super important. What brings you to the event today?
I'm speaking this morning and tomorrow morning, so I'm on the digital health panel this morning, and I'm on the patient experience channel tomorrow morning as well.
Got it. There's quite a few different tracks going on, isn't there?
There are. There's a lot here at Health Week, yeah.
And is there a bit of crossover, do you find, between the stuff happening on the digital health stage, let's say, and then the patient engagement side?
Yeah, I've been attending Health Week as a speaker for probably about 4 or 5 years now, and it's been interesting to see sort of as the events have evolved and as the sectors evolved, there's a lot more linkage between all the different parts of the event on the day. So it's been really nice to see sort of, I guess, the spirit of intersectionality and interoperability is coming together a little bit just in the way that people are physically connecting in the space too.
And what are you going to be talking about in your sessions today?
So this morning it's myself and a number of other panellists talking about sort of the consumer perspective on digital innovation and the usefulness and value of digital innovation to consumers in the health space. So there's a couple of, I think, interesting concepts that I want to sort of highlight this morning, talking about what's truly patient-centred. There's this fantastic analogy I like to use around sort of, I call it the Colosseum of patient centricity, and that's that from the top down, a lot of stuff looks patient-centred when we just cluster care around the patient, but then when you actually get onto the ground and have a 3D view of it, you realise that you're in the fighting pit in the Colosseum and all your care's 30 feet up behind a wall in the wings.
It's a pretty common kind of picture, isn't it? Like the two images, like the before and after, as if that's going to fix everything, whereas, the patient is one stakeholder and here is everyone. And then now we put the patient at the centre and have things point at it.
I think it's an interesting mark of how eager the sector is to adopt a new way of thinking, but in a number of other ways that there isn't the same maturity in how the application of that concept has been developed. So we end up with this probably a bit too simplistic view of, well, patient-centred care just means physically putting a patient in the middle of everything, which is not necessarily the case.
Yeah. Lastly then, Harry, what are you hoping that people walk away from your sessions today at Australian Healthcare Week?
I'd like people to take probably a more nuanced and matured approach to the way they engage with consumers in the community. I think I'd also like people to be able to recognise that consumers are often just more than consumers. I mean, this morning, me talking on the digital health panel is as much me as a consumer leader as it is a digital leader as well. So there's sort of a combination of two perspectives that I'm bringing. So it'd be nice to see people, I think, associating and engaging with consumers as bringing more to the table than just their lived experience. There's often a lot of really, really core sort of intersectional understandings of the way different systems and processes in the health sector works.
Hi, I'm Jeanette Anderson, so I'm the Director of Digital Health at the Eye Hospital in Melbourne. So I've got responsibility for the informatics team, our digital health projects that are part of the digital health strategy, and our ICT team, so servers, cybersecurity, and all those things roll up into my directorate.
An important directorate at that too, but what brings you to Australian Healthcare Week this week and today?
So it was exciting to get on a plane again and head to Sydney. It's been a little while, and so they asked me to talk last year about some of the things that we were doing at the Eye. We're in the middle of a really 10-year redevelopment project. So I'm talking at the conference about some of the lessons learned from our redevelopment and really how we need to integrate the electronic and the technology with some of the physical spaces and some of those challenges.
Yeah, right. And what are some of those, the biggest challenge that you're finding in integrating those two things together?
I think that a lot of times where the ICT needs to go is it needs to go in a closet and those kind of things that they've, as it's been an afterthought, but it's really making sure that you get on up front in some of that design, especially as we become more and more reliant on technology and the redundancy and those kind of things.
Yeah.
In the patient and clinical space, our patients have a number of more, we are an eye and ear hospital, so we have a lot of patients that need to read lips. So it makes it really important where you actually put the patients in the room and where you put the providers in the room so that they're able to get that eye contact, able to read lips, able to get the full experience, as well as patients who really need to know, our blind patients that need to really know where someone is in a space. So, making sure that we've got a lot of very clear egress and those kind of things, signage is critically important.
Yeah.
So it's some of those challenges that, it's around. And then where do you put the computer? So where do you put the computer in the room? How do you have to set that? How do you have to set that up? Because the best locations and places for computers and best way to use that computer is not necessarily conducive to also being able to speak to the patient at the same time and have that patient see their record.
Yeah. You mentioned at the start there that your remit kind of is all encompassing, including the cybersecurity governance. So there's those aspects are quite different to, where the computer goes or like the experience side of it. How much of your time do you find you're spending on the experience aspect versus the governance and the cyber? Do they interrelate? Are they two different worlds? Do we need to be bringing them closer together?
I mean, right now I would say they're probably a bit of two different worlds, but I think it's going to be more and more important that technology is everywhere. We know that. We know that in our daily lives, but we haven't quite translated that into what does that really mean for me at work versus what does that mean for me at home, versus what does that mean for me in a healthcare setting. Cyber is on everyone's mind, and as it should be, but it really is difficult sometimes to really produce something usable with multi-factor authentication. We have to have it. It's too dangerous to run without it, especially with some of the breaches that have happened. But it also doesn't necessarily make it super easy for the clinicians to share data and super easy for everybody to log in and those kind of things. So definitely some challenges in those areas.
And you're going to be up on stage at some point today at this event. What are you hoping that people will take away from the sessions that you're involved in today?
I'm in a panel for startups, and I think one of the important things for startups to understand are some of those challenges around cybersecurity, privacy, and really making sure that they understand the real challenges that there are when they hold very precious patient data and patient data that it can be harmful in a lot of ways if it gets out to the right people. So I think that's one of the things that we want to talk about at the session is, how are they aware of cybersecurity while still, allowing them to achieve the innovations that they want and that patient control of that data as they want. And then again, I think the other thing that it's, one of the things that, especially when we're talking about the redevelopment of a new facility, making sure that people, do bring those IT departments and ICT departments in. That we are actually able to be that part of the health system and part of, and really, that we're there from an ICT support system to support our clinicians and to support our patients in their journeys. So it's not an afterthought. It's not the guys in the basement, which is always fun for me as the only woman in a lot of meetings I'm in. But but ICT is not the guys in the basement. Like a good IT team really supports the patients and supports the clinicians in making sure that the systems are up, ready, available, redundant.
Hi, Peter. Nice to be here with you again. So I'm Grahame Grieve. I'm all sorts of things. I've been in Australia for a long time working in healthcare interoperability, data exchange, and I've ended up as product director for FHIR, which is the main standard for future interoperability. And as a product director for FHIR, I work with governments and vendors and institutions all around the world, exploring how we can better exchange healthcare data globally.
That's been your mainstay thing for quite a while. So
that's what I do.
It's not a health tech event without not a digital health event without Grahame coming and talking about FHIR. But is that what you're doing today? You've been on the stage already and got some.
Yeah, well, we're having a debate about whether Australia's on the right direction for getting to integrated healthcare with the digital infrastructure, and I think technically we won with a massive victory, but I think it was much more. It was much more even than that.
Yeah.
We're doing some good things and we finally have some really good directions, so we're going in good progress. On the other hand, there's lots of things we're not doing that we need to be doing, and we're still building better silos.
Yeah, right.
And that's what I said in the debate, and that pretty much was echoed all the way through. Are we or aren't we? Is that good or not? Yeah. But that's what we're doing. We're building better silos, bigger silos. But the bigger silos, the bigger they are, the harder they are to collapse together. And so I'm not sure that that's actually progress. Real progress comes slowly. Community standards, community development, consistent behaviour. No, we're still a long way away from that.
And so that's kind of the way forward then, is continuing the
there's such a strong 8/7 fire community concept of, growing together and doing that. Is that the way forward for us to continue to do that in that progressive way, building that? I think we talked about the plumbing in one of the really early episodes. Like that's what we're doing. Got to build the plumbing from scratch.
You've got to get the foundations and the plumbing correct. If you don't do that, then you're always going to be sliding around, the house on the sand thing. Nothing's changed.
Yeah.
And so I'm here saying, let's build some, foundations. The foundations are actually really hard because it's really easy to look like you're making progress and really hard to actually make progress. And I've been really frustrated, particularly with the former government, because they talk the talk, but they never walk the walk. And now at least we have better engagement, we have better planning, we have a government that's trying to walk the walk. I'm somewhat encouraged by that, and hopefully we can get in and actually achieve some foundational work.
I was going to say, last thing then, how do we take this from being a bunch of middle-aged white guys standing on a stage talking to the industry about this kind of thing to actually having like real meaningful impact that happens within healthcare? Like what can people take away from these types of sessions to implement?
I think most of them took away that we've got good stuff in train, but we got further to go. We got a lot more to do. How do you get away from the talking heads model? In some ways, we were talking about this afterwards. In some ways, you're not. In some ways, if we come back in 30 years' time and I'll be like kissing off and retiring, well done for retiring, we'll still be having the same discussion. Why can't we get anything done? But in fact, we'll be arguing about stuff that's not even possible to argue about today.
Yeah.
Right? We'll have achieved everything we're doing today and we're still having the same discussions about something we've never thought of as possible. And so in some ways, the discussion never changes. Why can't we progress faster? But actually we're doing stuff. And so stuff is happening slowly, but I am hopeful that over the next 10 years we can, as other countries succeed at doing what I'm advocating for and we're left behind, that we'll succeed in internalising the value of investing in building the foundations correctly. Right? We pretty clearly had a government that wasn't building proper foundations and we're now seeing the cost of that. I'm kind of hoping that we'll get the point in digital health and we will be able to more efficiently achieve the things we're arguing about. But in the end, for me, the biggest single thing that we need to do in Australia is build the workforce capacity. We just don't have enough people doing healthcare IT in depth and who are making it a career and building out capacity. Companies can't hire people. Institutions can't hire people, so a lot of our effort goes into skilling up the few people that we have. And so for me, workforce is the actual biggest issue.
So my name is Sandip Kumar. I'm the Exec Director for Strategy, Transformation, Major Capital and Digital at Gold Coast Health. So I get to oversee a bespoke transformation function inside healthcare that we've built in Gold Coast over the last 3 years. I get to oversee all major capital initiatives at Gold Coast. I get to oversee a lot of our research agenda. I get to play with all the technology innovation that we're driving, all our revenue models. So I get a really broad aspect, strategy, planning. So there are 15 different functions in my division that kind of work towards the future, really.
Sounds like a fun gig.
It's very exciting, yes. Very broad too.
Yeah. And what brings you to this event today?
What really excites me about these events is just opening my mind to what other providers or technology companies are doing, and it's really just a pressure test for me to see, are we making the right choices? Are there other solutions that are better than ours? Is there thinking that we should adopt? But also, it's nice to connect with a community of innovators that are kind of future focused.
And so are you up on stage at some point today in a panel?
I've spoke for 50 minutes. It was called The Great Debate about integrated care. I was on the yes side.
Yeah, and what does that mean? Talk to me a bit more about it. What happened there?
Yeah, look, integrated care for us, it starts with my CEO really. 10 years ago, Ron Calvert, who's the CEO of Gold Coast Hospital and Health Service, came across to the UK, really focused around this idea of that integrating care across primary, acute, NGO type providers. And the whole philosophy was, can we make sure that whatever we do is all centered around the patient, which is ultimately what we always talk about, and really that we drive the use of resources and capacity to best effect to meet the patient's needs. Now, that sounds like a bunch of words, in simple words. If a patient needs healthcare,
Yeah.
And are they accessing the right clinician at the right time? Is it in the right environment? We don't need patients languishing in hospital beds. That's not what they want. It's not what we need. And so integrated care is really about making sure the patient is serviced in the community where they want to be serviced, and it's the right clinician in front of them, giving them the best possible care. So, so that's what the debate was about. And with a slight digital edge, it's about how does technology help, and I think technology can play a significant role in that.
Yeah.
And so at Gold Coast, we stood up an initiative about 12 months ago. It's called the Liberate Initiative, and it's probably my proudest transformation program. And Liberate's really about liberating our staff and our patients, and about using technology to connect the patient and the clinician, but also using technology to make sure that the clinician's focused on care and they're not wandering around having to figure out lots of administration tasks in order to actually provide care to that patient. So it's a scaled digital workflow agenda, integration, automation, advanced analytics, web, digital assistance. And the best part about Liberate is we're developing it all ourselves. And so we've gone from constantly procuring in the market, looking for a solution, building out user requirements, to no, let's build our own product-based teams, let's develop with our clinicians and build on platforms that make sense for healthcare because they're our platforms. And so a very different environment that we're working at Gold Coast right now.
That's really interesting. And I almost had to double take for a second. It didn't sound like you were speaking from a not picking on Queensland, but just like public hospital system and thinking about innovation and how to build that capability. And it sounds like you're looking at things quite differently at Gold Coast. Yeah,
I mean, the teams that we brought in, that we handpicked inside the Gold Coast Health Digital and Information Service, they were people that didn't work in healthcare. We brought in an ex-executive from the airline industry. We brought in product-based teams that have worked in banking, that have worked in retail. And what they brought in was their thinking about, let's stop thinking about applications, let's think about products, let's stop thinking about procurement, let's think about platforms, let's stop depending on the market, let's develop our own. And I can see the benefits now, the pace at which we move, but most importantly that we're building healthcare products for healthcare workers, or we're building patient products that patients can actually use. And we've started to nail this idea that great experiences drive adoption, and adoption drives value, and that's what it's all about.
Last thing then, particularly to, different innovators or the vendors that might be either attending this event today or listening to the podcast, on one hand, it's really exciting to hear about a health system that's a hospital health service that's, looking for innovation and looking at new ways to do things. At the same time, it's like, if they're going to build it all themselves and there's not, an opportunity to partner with these types of things. Any advice for vendors out there that are creating solutions from outside of the system?
Look, I think public sector's role is to make sure we're shaping markets. And so what we're actually doing is enabling the market to focus on what's really going to be meaningful. We know we're not going to be able to solve everything. We're not going to be able to build an EMR at Gold Coast. We're not going to be able to produce all the AI, ML products that are out there that are really patient-facing or really deep in the clinical realms. And so basically what we're offering the market is a way to focus on what's going to be most valuable to them, and also ultimately what they can compute across industry as well. So although we are, like you said, developing our own solutions and controlling a bit more of our own destiny, we still think there's a really important role for the marketplace to answer the things that are a bit more complicated, that there probably is likely going to be more value in the market for them as well.
So I'm Alan, the CEO of Patient Experience Group. We do strategic advisory and transformation for large healthcare organisations, clinics all around Australia, and a few international clients as well. But the main piece that we do is strategic advisory, and we really get into the nuts and bolts of, especially in this day and age of health data, how do we use it? Because we are awash with data. What do we do with all of this data? How do we make meaningful change in our systems, in our organisations, with so much quality information?
Well, that's interesting, isn't it? Just before we get on to anything else, because there's that whole conversation that we have in the health tech space around how we capture the best quality data and how to make it more interoperable. But then it's kind of like, well, why? Like, what do we do with this thing?
Yeah, that's right. In many healthcare organisations, we see it is a means to an end, and we see entire departments set up just to collect data and report on data. We see dashboards, and some of them are really fantastic. The technology out there is really, really great. But what do we do with this information? And this is what we do at Patient Experience Group. We provide advisory, we do consulting on how we can make changes in organisations, not just from an IT perspective, but organisational change to improve quality for staff, to improve quality for patients, to shorten journeys, to make it easier for everyone to actually get the services that they need.
Yeah. And so patient experience, obviously front and center with what you do. I guess it makes sense that you're over on the patient experience stage.
That's right. Yes. So today I was running a panel just earlier talking about some of the emerging risks that were coming out of the digitisation of the health sphere. And there were really powerful discussions in what we're seeing, whether it be with remote care, which is a side effect of COVID. It's something that we all had to go through, but then subsequently something that we are now embracing and living with, where we're able to potentially outsource, as an example, radiology services, where we can have radiologists on the other side of the world during business hours looking at scans and providing reports. And we can outsource these things. We can embrace the entire world's resources in order to get the information, and at the same time it leads to a depersonalization in healthcare. It's a double-edged sword where we have access to so many resources and it becomes less personal, which is a real challenge, because from a patient experience perspective, we want things to be more personal, more emotive. We know that patients tell us all the time they want connection with their providers. And if we think about what we had in the past, we had this great relationship with, say, our community GP, where we would see our GP for 20 years and we would grow up and our parents would take us to the doctor and we'd get to know these people and grow up with them and then take our own children. And now all of a sudden we are stuck in positions where there is a GP crisis and we're not able to get into some of these GPs anymore. And so we see emergency departments awash with patients because there are gaps. And then those emergency departments, because they are challenged by resourcing constraints, look to then outsource some of these functions, and the whole thing just snowballs and patient experience spirals downwards simply because of the way in which we've changed over time.
Yeah. Way to make me feel like progressively anxious as you went, because it's kind of like in a funny way, because as you say, the snowball, it's compounding, it's creating pressures, and I guess that then bleeds out into what we see with workforce burnout, the shortages that you spoke about, but the challenges generally we're facing within in an environment where patient increase in chronic disease and other complexities. What do we do with all this kind of tricky situation?
Yeah, absolutely. So, and I know it sounds extremely negative and depressing, and we're all disconnected. And even though there are more people in the world than ever before, and we've got more resources than ever before, it seems like we are more and more disconnected because of the way in which we've designed these systems and the way in which we've had to adapt.
Yeah.
But some of the exciting things that are actually coming out of this are especially around co-design, and it's something that we hear a lot about in the digital health space, but it doesn't have to just be about digital health. It can be about the way in which we design services and service delivery in healthcare as well, and it's something that I'm really passionate about, bringing that patient voice and bringing the staff voice, whether we're talking with nurses, whether we're talking with doctors, specialists, allied health providers, aged care. All of these organisations, all of these groups, all of these cohorts have something to contribute to this co-design process. And if we're all able to get together and talk about what the best pathway forward is in a patient-centric way, in an experience-driven way, then the world is all of our oyster. Like, we're going to succeed no matter what, as long as we can bring that voice to the table. And that's not only the challenge, but also the opportunity. And we do hear a lot about co-design. We're yet to see organisations truly embrace it from an end-to-end perspective, but there are some amazing initiatives out there from large healthcare organisations that really do believe in this stuff. We do hear a lot about ward-to-board type dashboards, ward-to-board measures and metrics, but now we're actually starting to see organisations act on these things, and it's a marvellous space to be in.
Any other final comments, or given that you're going to be chairing up the stage on day 2. What are you hoping people take away from that, or anything else to close it out?
Yeah, it's a really interesting question. I think for me, what I'd love to see people take away from this entire summit is the importance of voice. And I know we're sitting here in front of microphones and we're using our voice in order to communicate and get this message out, but it's something that we really need to not take for granted, because that voice and bringing the voice into the room, especially for patients that may not necessarily have a voice. If we think about pediatrics as an example, we don't often address children the way in which we would address adults, simply because they can't communicate to the same level as we can, but it doesn't mean that their voice is any less important. And that's true for every patient, especially patients in minority cohorts, Indigenous patients, aged care. All of these voices are so very, very important. And if there is one message that I'd love to see everyone take away from this entire summit, it would be that this voice and bringing this voice into the room is the message that we really need to embrace.
Hi, I'm Sandra Cook. I'm from ACT Health, and I'm the Executive Group Manager of our Digital Health Record program there.
Great to have you here. And what brings you to the event today?
So I was a speaker yesterday and was able to talk about the ACT Health Digital Health Record journey that we've just been on, and really proud to be able to talk about the team's efforts there. We've had really good collaboration across the whole public health system, so really moving on that journey to having a territory-wide solution for our public health system, which is amazing.
There's this really good opportunity, isn't there, to be able to do something like that, have a territory-wide solution that hopefully can obviously service people within the territory, but hopefully provide some inspiration to other health systems as well as a demonstration of what's possible.
Yeah, absolutely. And in the ACT, we do have a breadth of services that we provide. So the public health system's responsible for breast screening, for example, which I know is different to other states and territories models. So we have this opportunity where we can actually connect a whole bunch of information and hopefully provide a better patient experience. One of the things that's been really great with the implementation of the Digital Health Record program in the ACT has been the patient interaction with their own care. So the patient portal that we have, we've got 185,000 people that have signed up to it. And since we went live in November, 40% of the people who have accessed public health services in Canberra have been using it to help them with their care. Some of the patients are getting their pathology results within an hour and a half of having their test done. And they're able to see all of the, scheduled appointments and after visit summaries, which are in patient language. So it's, not discharge summaries for the clinicians, but it's actually what do I need to do for my healthcare now that I've had this interaction with the health service in my simple plain language. Yeah.
That's a really important point in itself. And before, I wanted to go into that for a second, but just to go back one, for those that might not be totally aware of like the breadth of this transformation. So it sounds like then it's a rollout across not just in the hospital space, but across pathology and different parts of healthcare, bringing everything together.
Yes, that's exactly right. We went live with the system in our 3 public hospitals in Canberra, in 44 community health centres, 5 walk-in clinics, and then our Justice Health as well. So it is fully across the territory.
So you go into one hospital here, and then if you're going to a community centre here, they kind of know who you are.
Yes, yeah, exactly. It's
crazy, right?
Crazy. We're sharing information. It's amazing.
And not only that, but also that point that you raised before, something that I don't think we've been historically good at in healthcare is being able to contextually communicate information. It's one thing to make available a PDF, but it's kind of like, well, what do I do with this information? So that's really great that you've got that front of mind. We can talk about being patient-centric, but unless we're speaking in a language, not just the same language, but in a way that people want to know.
Understand it. Absolutely. Yeah. So, I think we're only at the beginning of the journey, of course, we're 4 months into using the system. We're still issue resolving, But overall, things have gone pretty well, and we've got lots of opportunity now to actually expand what we can do. So we started with a pilot for our providers. We've got 4 GP practices and our Aboriginal health service Wanunga using our provider portal. to be able to get more information on patients that have been in the public system as well. And we're going to evaluate that in June to see, has that been really helpful? What are some of the other things we need to do differently? We've taken a risk-averse approach with consent models for that. So we need our patients to say, yes, I'm willing to share my public health record with my GP. Because it's a longitudinal record. It's not just about the episode of care. You can see the whole history of the patient. And so that's been a bit risk averse, and we're getting some feedback and information from our GPs on whether that's actually doable. If it's something that is going to be blocking us, we'll look at changing legislation.
I was going to ask, lastly then for, those perhaps working in other health systems, living vicariously through the great stories that you're sharing today, or even just generally people working in health looking to get, to drive some transformation when it might otherwise feel difficult or stagnated, what would be some of that advice? But some of those things you just mentioned then about getting that feedback along the way and iterating and doing steps, that's great advice in and of itself.
Yeah, definitely. Look, I think we take a bit of a you only live once approach.
Nice. I like it.
And I definitely did a YOLO moment very early on in the program when the COVID vaccine came out, and we had a choice of going with something like a customer relationship management kind of portal to capture our interactions with vaccinations, or whether we actually took the leap of faith and just go forward with the digital health record doing that function.
Yeah.
We had no infrastructure at all at the time we had to make the choice, and we really needed to get something out there within 3 weeks, but we did it. We built 56 servers, migrated 1.4 million records from our ACPAS system, got a portal out there for Canberra community to actually book in for their COVID vaccination appointments. And now we have that data in the longitudinal digital health record for in 5 to 10 years' time if there's information that's going to be valuable on COVID for us moving forward. So, I think you just have to kind of sometimes go, yes, government's risk adverse, but let's weigh up all of the things that we're looking at and let's give it a go. If it fails, okay, it fails.
Yeah.
And we have to own that. But, sometimes I think you have to think about the longer term kind of thing that you're looking to do.
Ben Chiarella, I'm the Director of Clinical Innovation for Ramsay Connect.
What's Ramsay Connect? Ramsay Connect?
No, it's a joint venture actually. So we're a standalone sort of organisation born out of both Ramsay Hospital Group and Remedy Healthcare, looking at innovative models of healthcare and sort of health reform, I guess, more than anything else.
Interesting. And so is that, people might know Ramsay as, the physical bricks and mortar hospitals, right? But it's more services, consulting,
Look, it's I guess what we're trying to do is look at models of care that are virtual in some, so non-bricks and mortar, and models of care that are all based in the human home. So hospital and home, rehab in the home, and then a virtual home health service as well. So no bricks, no mortar, no walls.
Yeah, interesting. And so you're here at the Australian Healthcare Week event in Sydney, and I think I saw you up on the stage before. What's going on there?
Oh, look, able to sort of come out here and preach the gospel, I guess, of Ramsay Connect and the work we're doing. But really, I guess, looking to, just sort of have a conversation and find the coalition of the willing we often talk about, who are interested to challenge how we currently deliver healthcare in Australia, look at models of care that currently aren't funded and trying to find ways to, do things differently. So, yeah, great opportunity to sort of, meet the fellow people who are interested in that space as well.
Yeah. Did you see any themes or trends or key takeaways that you think people might walk away from this event with, hopefully will then be implemented in their own health settings?
It's a sense of frustration that things seem to take so long. I think, there is a sense of deja vu often with these conferences where you hear the same conversations over and over again. But I think there's a sense of optimism that we are coming out of COVID into and I'll quote the panel before me, that the future is now type. And if we can't make change now in Australian healthcare, when can we make change?
Hey, Ruby.
Hi.
Hey, we're at the end of day 2 nearly. So,
Almost.
yeah, thanks for helping on the stand.
Pleasure.
Thanks for being a community ambassador representing Talking HealthTech and chatting with people. How was it?
Yeah, it was awesome. Thank you for having me here with the networking and I mean, speaking to people, just having so many thought-provoking conversations on the stall.
Yeah.
It's just like everyone's gathered around talking about like different parts, whether it's AI and accessibility, whether it's community health, and then just listening to all these conversations and the different perspectives. And it's just, I think it just shadows what you do with your community. So,
Well, hey, look, it's great to have you as part of it too. And being an ICU nurse, I mean, there's a lot of conversations that I saw you were having that, you were sharing your experiences that of things you faced on the front line where technology can make a real meaningful impact, right?
yeah, and I guess you see that, I guess the applicability and the implementation of how these things can actually help, but all the barriers that come with that and the inability for us to accept technology in our everyday working life, which is changing, but having 10 different databases and 10 different systems that don't speak to each other, and having these conversations about interoperability and all those things is just very interesting because you see it every day and you're dealing with these problems every day on top of the workforce, like the shortage in the workforce, and being like, oh, this will fix that, like instead of wasting half an hour sitting in the computer trying to hand things over.
Well, that's it. And we've had a good kind of, front row seat for the digital health stage over here as well, and checking out some sessions here and there. Are there any kind of key things that you're going to hope that people take away from the sessions today? Or what do you think are some of those recurring messages that you've heard either from sessions on the stage or even just people speaking to you here at the booth?
Well, I think the key goal here is everyone's here to work out how they can work together to face the problems in the healthcare system. And that's why I've actually really enjoyed being here, because everyone's looking for solutions. And I think the key here is that middleman between the tech and the hospital systems, or the tech and the primary care systems, and the actual integration of the two. And I think that's where there's barriers, but that's where people talking from each side of the fence can then come together to solve those issues. I think that's like the key message that's come across. Yes, there are plenty of barriers, and yes, there'll continue to be barriers with the technology and with all the other things, but that those things are being talked about, I think. I mean, it starts with a conversation.
Oh, dude, freaking nailed it. There you go. That's it. That's done.
For more content and community about technology and healthcare, visit talkinghealthtech.com.